Germinomas are malignant intracranial tumors that fortunately are very treatable and curable. Peak incidence is in childhood and adolescence, like this boy, and it's mainly boys over girls. There's been three patterns described. You get the suprasellar lesion associated with a pineal lesion, so this is probably a very common presentation of the dual germinomas, anterior and posterior. He had just primarily anterior involvement here in the anterior third ventricle. And then there's one that's just completely intracellular. I haven't seen one of those before. Common symptoms, when they occur in the suprasellar region, they can present with diabetes insipidus, visual disturbances, and obesity. The pineal region tumors present with hydrocephalus and Parinaud syndrome, where they're unable to look up, and other findings. CT scan depicts isodense or hyperdense lesions. Now, the reason that we, in Japan for a while, they were just doing what was called a radiation biopsy. They'd give 2,000 rads and see if it went away, and made the presumed diagnosis of germinoma because they are so exquisitely radiosensitive. But people have argued that these can be mixed tumors because they're germ cell line, and a small percentage of them also have yolk sac tumor findings or choriocarcinoma, and so the biopsy is often to try to exclude these others. And we do send CSF for alpha fetoprotein, beta HCG, and other markers. Yeah, we measure beta HCG. It can be slightly elevated with germinomas, but in chorios it's very elevated. That's another clue often. And these tumors respond very well to chemotherapy and radiotherapy with a fairly high cure rate. And what you see here is a remission rate of 70 to 80%, which is hopefully he will be in that category. I think this is an example of one that after radiation that basically just they disappear.